Good morning, good day, good evening. Welcome to East Bay Insiders TV. I'm Steve Tavares. After years of uncertainty in the East Bay, Alta Bates Hospital in Berkeley is being rebuilt in Emeryville. With me today is Doug Jones, a longtime political organizer for SEIU, United Health Workers West. Welcome, Doug.
Good to be back with you, Steve.
You go to the beginning of my journalistic career way back in like 2010.
It was really worthwhile for us to work together to make sure that San Leandro Hospital did not close. One of the many times when Sutter Health has tried to take away vital healthcare services for the community. And I really appreciate the leadership that East Bay Citizen at that time took in helping us win that campaign.
That was the predecessor of East Bay Insiders. But let me break down with we talk about this new planned hospital. Let's break down with the numbers first. So Sutter Health is planning it's a $1 billion, 1.3 million square foot campus that right now can have up to 200 acute care beds in Emeryville, and that will replace the seismically deficient Alta Bates Hospital in Berkeley. I think I just want to start out. So you were talking about the San Leandro wars that I wrote through and you battled through. Why should Emeryville and the East Bay be a little bit wary of this plan, at least right now?
Right. Sutter Health has a history of trying to provide only the services that they can make a lot of money on. As an example of that, one of the things that's happened in recent years is that elected officials and community leaders have been held responsible for the amount of untreated mental illness that we have in our communities. Amongst the causes of that are private sector providers like Sutter Health, who have done things like what they did when they did the rebuild in Castro Valley, which is they closed a 20-bedded inpatient psych unit at the old Eden Hospital building. The new Eden Hospital building was built 50 beds smaller than the current one. It is maximally full constantly now and is not providing the amount of services that the community needs. So it's important. Obviously, we successfully prevented them from closing even more inpatient beds in San Leandro by keeping that hospital alive despite Sutter's best efforts. One of the things we did lose when we had the county take over San Leandro Hospital services is that 2 of the floors of San Leandro Hospital are now taken up with rehab services, which the county does need. It was valuable that the county had some place to place some of its inpatient services or its rehab services, but that's still 2 floors of inpatient acute care hospital beds that are lost to the community. Fortunately, the emergency department and everything else was preserved in San Leandro. But we saw during the pandemic that we don't have the capacity for inpatient services when there is mass illness in our community. And we also know during the lifespan of this current hospital that is being contemplated in Emeryville, that it's fairly likely that the next catastrophic earthquake will take place. The Hayward Fault has not gone off in over a century, and it's been due to go off for a while. Hospital buildings these days are built to last 30 to 50 years. It's fairly likely that the next earthquake is going to take place, and we're going to need a lot of acute care inpatient beds to take care of the people that are injured out in the communities when that happens. So both from the standpoint of the pandemic that we just went through, when there was an overflow, people were waiting in the emergency department acutely ill for days without being able to get an inpatient bed. But that was the best we could do under the circumstances. It's really crazy making that Sutter Health and other private sector providers who are making tons of money off the current system could provide the amount of safety net services that the community needs, continue to try to make these decisions where they restrict access. So, for example, in the case of the current discussion about replacing the Berkeley Hospital, you say it's seismically deficient. It's not seismically deficient until 2030. Sutter Health could have made the decision to go ahead and invest in that campus it wasn't it wasn't seismically deficient that they couldn't address, right? They're making the decision to build the new hospital elsewhere. For many years, they didn't even want to build it at all, but we finally won that fight. But if they build the hospital over 100 beds smaller than the current Berkeley hospital, the current Berkeley hospital has a 339 bed capacity. That's what it's licensed to take care of. If they build the hospital over 100 beds smaller than we currently have, that will be depriving healthcare, safety net healthcare services to the community. And it's something we're determined to try to help impress upon the government of the city of Emeryville, that it's really important that they make the right decision, not on just behalf of their own constituents, but on behalf of the entire East Bay community that needs these safety net services.
It sounds like, because the unions, of course, I'm not against the plan, correct? I mean, it's another place for workers to work. So that is not the issue, right? The issue is about a lot of this thing you're talking about of in terms of services and even the safety net. Can you talk about some of what's happened before in other places? And this is this is why I've been writing about this and covering some of the Emeryville City Council and you speaking to them, is because what happens with is there a history of the safety net services, what you might say, another person might say, that don't necessarily make a hospital a lot of money? What has happened to those, and what do you worry could happen here with the changeover to Emeryville?
One of our members who works at the CPMC Mission Bernal facility, the only hospital south of Market in San Francisco, one of our members came to the Emeryville City Council recently and told the council that Sutter Health had made an agreement when it built its new hospitals in the city and county of San Francisco, CPMC hospitals. They had made an agreement that, amongst other things, they would preserve labor and delivery services in south of Market, in the Mission Bernal Hospital. They just plainly violated that agreement a few years after the hospital was built, and they closed labor and delivery. Now, we've been fighting to try to get the city and county of San Francisco to enforce the agreement that Sutter Health made with them. But the point that our member was making with this Emeryville City Council is that it's important to know that they're not trustworthy. Sutter Health does things in order to push things through things on the short term, and you're going to have to work really, really hard to make sure that not just that the new hospital is built with the number of beds that are necessary, but they meet their commitment in terms of the services that they provide there. Because Sutter Health is going to be very, very happy in the Berkeley building, which will remain, but won't be used for acute inpatient and emergency department services anymore. It's going to be a big, huge outpatient hub. It's not like they're tearing down the Berkeley building. They just can't run acute care out of there anymore. They're going to be super happy to run neurological care, orthopedics care. These are the sorts of programs that reimburse very well. They're provided almost entirely through private health insurance. But then there's things that are typically provided through public health insurance, like acute psychiatric services, like labor and delivery services. These are areas in which Sutter Health has a history, as I shared at both Mission Bernal and at Eden, of closing those services. And obviously, we just had a situation in St. Rose Hospital. So shortly after Alameda Health System took over that financially failing hospital, they closed labor and delivery there. And obviously, the people that care about healthcare, like we do in Central County, want to see those labor and delivery services reopened as well.
Well, Doug, thank you so much for bringing more light to this story. And it's early; we're early in the process, but that's usually when it's all set. If anything's going to happen not suboptimal, you can look back and see it started from the beginning. So that's why I want to keep it shining the light on this early on, because again, like I said, I saw a lot of this stuff. 14 years ago at San Leandro Hospital and the Eden rebuild. So thank you so much.
Yeah. Could I take one more moment to mention that this all happens in the context of contract negotiations, which are taking place for SEIU UHW members at almost all of the Sutter hospitals where we represent in Northern California. So that includes Eden. That includes both campuses of Altabate Summit, both the current Berkeley Hospital, which is going to operate until 2030, and the Oakland Hospital. It also includes Antioch at Sutter Delta and 4 other hospitals. Those contracts all expire on September 13th. Contract negotiations have just begun. We wanted to begin them earlier, but Sutter Health delayed the beginning of these negotiations. And the first proposals that management has made across the table have been woefully insufficient. And also, I'll just mention this, we've asked to meet with them directly about the move of services from Berkeley to Emeryville for Altabates. They have refused to meet with us on that at all. So we've asked for those meetings for months now. One of the things that can happen when we do that, when we meet with them directly as workers, we can not only try to protect jobs, we can try to protect services, right? We can know more about what they have in plans. We can ask them more direct questions than the Emeryville City Council has made. They've refused to meet with us. And Sutter Health is simultaneously asking Senator Arreguin to carry a bill for them, which would streamline some of the efforts that they're making for this Emeryville rebuild. Senator Arreguin has assured us that if Sutter fails to meet with us about our concerns about the Emeryville rebuild, that he will not finish moving that bill to completion, and we plan on holding Senator Arreguin to his commitment in that area. He wants to see Sutter Health meet with both us and the California Nurses Association to address our concerns about the Emeryville rebuild.
All right, that sounds like that's a breaking news there, right there. That sounds like an item in the East Bay Insiders, that last part. But thank you, Doug.
I'm happy to share it with you today. And again, as soon as September 13th, unless Sutter Health reestablishes a willingness to enter into good faith negotiations at all these hospitals, we could have workers out on the strike line throughout the East Bay in September.
I'll be watching that. Doug Jones, political organizer for SEIU United Healthcare Workers West. Thank you, Doug. And for everybody else, don't forget, for more, subscribe to East Bay Insiders newsletter at eastbayinsiders.substack.com. Thank you.
Good to be with you, Stephen.